Good afternoon and welcome to our first HEART webinar, Effective Collaborations for School-Based Mental Health Services, with Andrea Amador, Senior Director of Behavioral Health Services for Boston Public Schools, and Shella Durney, Director of Boston Children's Neighborhood Partnerships Program. We're also joined today by Dr. Martha Staley, the Director of the School Mental Health Initiative for the New England MHTTC, and myself, Dana Asby, the Education Coordinator for the New England MHTTC. Our funding comes from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's webinar are those of the presenters and moderators, not SAMHSA. Microphones will be muted during the presentation, but at designated times during the question and answer session, you can use the raise your hand feature to request an open mic. When you are speaking, please be sure to eliminate background noise. You can also submit questions for the presenters throughout the presentation using the chat. We're pleased to offer the option of closed captioning for this webinar. You can select this option and change your transcription settings by clicking the CC Live Transcript button at the bottom of your Zoom screen. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat message to Ingrid Paget, our technical support manager for today's webinar. The Mental Health Technology Transfer Center uses person-centered, affirming, respectful, and recovery-oriented language in all activities. During this webinar, please ensure that whenever you are contributing to our discussion via chat or during the question and answer session, please use language that is strengths-based, healing, and trauma responsive. We're pleased that you joined our webinar, and I'd now like to introduce Andrea Amador. She's the Senior Director of Behavioral Health Services for the Boston Public School System, and Andrea has dedicated her career to urban school psychology and began as a school psychologist before becoming an administrator. Andrea, along with her staff and partners, have developed the comprehensive behavioral health model. Presenting with Andrea today is Dr. Shella Durney. She's a part-time faculty and teaches group therapy at Boston College School of Social Work. Dr. Durney is the director of the Boston Children's Hospital Neighborhood Partnerships Program, the Community Behavioral Health Program in the Department of Psychiatry at Boston Children's Hospital. She also directs the comprehensive behavioral health model in partnership with Boston Public Schools. Thank you both for being with us today. Martha and I will kick us off before passing it off to Andrea and Shella. First, we're going to do a brief introduction to our webinar series and community of practice. We'll talk about developing positive listening practices using person-centered language. And then Andrea and Shella will talk about their very effective collaboration on the Boston's comprehensive behavioral health model, as well as the importance of relationship building and how to set roles and responsibilities. We'll close today with some questions and answers. So first, let me introduce you to the HEART Collective, tell you why we are bringing this to you today. This is a collaboration between SAMHSA, HRSA, the New England MHTTC, as well as the New England Addiction Technology Transfer Center and the Prevention Technology Transfer Center. We came together and formed a committee of behavioral health and education leaders throughout New England, as well as folks with lived experience of mental health challenges during their school-aged years, and some family advocates as well. From those committee meetings that we convened, we identified some common barriers to effective collaborations for comprehensive school-based mental health systems building. You can see some of those barriers on the screen there. I'm not going to read all of them out, but we did develop this webinar series trying to address all of the barriers that were identified. So today we're really going to be introducing you to a really gold standard collaboration between a healthcare institution and a school system. And hopefully, if you join us for some of our following webinars, you'll get some information on overcoming some of these other barriers, especially around funding and how to move beyond episodic care, how to really make sure that we are including equity as well in our comprehensive behavioral health systems in schools. In the HEART Collective, we also edited our compassionate school mental health model, which really drives all the work that we do in the New England MHTTC's School Mental Health Initiative. In addition to HEART, we also work with the Childhood Trauma Learning Collaborative and have a webinar series under that program as well. So please do check out our website to learn more about the events that we have. And we really do believe that serving our young people includes prevention, support, building resiliency, and developing protective factors wherever we find youth, whether that's in the home, the community, the school, or other youth serving systems. Our webinar series and community of practice, it has two different components. Today, we're here at one of our knowledge-based webinars where we're going to deliver a few evidence-based practices for enhancing collaborations between schools and healthcare institutions, community health centers, behavioral or mental health agencies, or community-based organizations for these comprehensive school mental health systems. So at the first Thursday of every month at 4 p.m., we'll have a webinar. And then on the fourth Thursday of each month, we'll have a community of practice. And that's a time for us to come together as peers to discuss the things that we talked about in the webinar at the first of the month, also to bring successes and challenges around whatever the topic for that month is. So if you want to join us to ask questions of your peers and myself and Martha, please do come back on the 20th at 4 p.m. where we'll talk more about the very first things we need to think about to start these effective collaborations. And then you can see the calendar of events for the rest of the series, which will end in May. So please do join us for that. And I think Ingrid is going to pop a link to the registration in the chat. And you need to register for each of the events individually. So we hope to see you back at some of these events. So let's talk about developing these positive listening practices, which are a really key foundation for getting effective collaborations off the ground. First, we need to understand whose voice we need to listen to. When we are talking about these collaborations, sometimes as administrators or mental health providers, we might think that we have the best ideas and we can just start planning and getting this thing off the ground. But it's really much more effective if we get some opinions from all of the various people who will be affected by this mental health support system. So who is your audience? Who are you trying to hear from? We really need to make sure that we're gathering opinions from students about what their needs are, especially students who have mental health challenges that have been identified. In addition, we need to talk to those students' families. They might have insights about what's going on at home that might inform us about the mental health challenges. If we are educators or mental health providers, we need to loop the administrators who have decision-making power into all of our planning and discussions from an early point. If we are administrators and trying to set this up from a top-down point of view, that might not work if we're not involving the school mental health providers who are really directly on the ground with the students doing this work into the conversation. We sometimes might forget that teachers who are with our students for the majority of the day are also really important voices to hear from when we're designing this system. And then paraprofessionals often spend a lot of time with students who are struggling with mental health challenges in one-on-one and small group situations. So making sure that we get the opinions on all of these people. If you could think of anyone else in your audience that you might want to hear from, go ahead and pop that in the chat. We also need to consider gathering those opinions in a variety of ways. We can do surveys, both paper or online. We could do social media posts where we turn on the comments so that folks can comment on whatever idea that we're coming up with. We can hold town halls. Right now, it might not be so safe to do those in person, so those could be virtual. We can also have focus groups in person or virtual, as well as one-on-one conversations with any families that might be using the services that we are trying to improve or develop a little more strongly. We can also just think back to conversations and interactions that we have had with families and students and staff and reflect on how those opinions that have been shared in the past might affect our plans moving forward. If you have any interesting ideas for how you have gathered the opinions of people in your school community, please share those in the chat as well. And then we have 4 ideas for you to teach staff positive listening and conflict resolution skills. In the interest of time, so that I can give Martha a few minutes to talk about person-centered language, I'm going to skip going over these, but they'll be in your slides. These are just 4 ways that you can teach staff how to listen more effectively to reduce conflict and also stop conflict in the moment when it's happening, de-escalate when a conflict is becoming unmanageable, and reflect back after a conflict to try to find more appropriate solutions in the future. I'd love to pass it over to Martha to talk about person-centered language.
Hi, good afternoon, everyone. I'm Dr. Martha Staley. I'm the director of the New England MHTTC School Mental Health Initiative. And I just want to take just a couple moments to talk about using person-first and strengths-based communication, whether you're in a school or in a healthcare facility or organization or a community provider. It's important, particularly when we're thinking about kids and students, to use person-first language. So making sure that our language begins with the person unless otherwise requested, like using the phrase student with depression rather than depressed student. It's also really important to understand, affirm, and communicate that a mental health challenge is only one part of who the student is, that students are not their diagnoses, they are much more than that, and to be really careful in the way that we're talking about avoiding stigmatizing language like crazy or mentally ill, or even the phrase committed suicide. Educating yourself about who your students are, where they come from, what their cultures are, how they identify, even if some of their identities might not be immediately obvious to you. It's important to do your best to respect and honor who students are as individuals. Next slide. So to do that, it's important to be willing to listen with acceptance for the person's experience, to show that you're supportive and interested, affirming the student's strengths. This is really important. So instead of solely focusing on problems, make sure that you're using language and pointing out the ways that that student is successful, and to keep your reactions to yourself, whatever they are, whether it's shock or disapproval or disgust, which can really be a barrier to communication and connection. And in terms of language, we all get it wrong sometimes. It's inevitable, but it's important to apologize when you need to. When you're in doubt about the kind of language you're using or strengths-based communication, cultivate curiosity in yourself, ask questions respectfully, lead with compassion, and consider how you want people in your position to speak to your child or loved one. And now I am going to pass it to Andrea. Andrea, are you going first?
Yep, I'm going to share the screen for both of us. And Shelley, start us off, Shella.
So it's great to be here. Good afternoon. I know it's late in the day. I just want to thank all of you for being here. We know it's an extraordinary time, and I know many of you are affiliated with schools, and we know it's an incredible time in schools as well. I'm Dr. Shella Dennery, and I'm the director of BCHMP, and I'll share a little bit more about that in just a minute. Andrea?
And I'm Dr. Andrea Amador, and I'm the director of behavioral health for the Boston Public Schools.
So our agenda today is really pretty simple. We're going to talk really quickly about our day jobs in schools, and then we're going to talk about effective collaborations, and we're going to share some examples from our work in Boston that's collective and sort of beyond. And we'll sort of close out with successes and lessons that we've learned over the last 20 years. And then we will leave time for questions at the end. And so we look forward to hearing from all of you as well then.
So I'll start with a very brief overview. We're going to try to be fast with some overview of our work so that we can get into the collaboration. But Boston Public Schools is currently comprised of 124 schools. We have around 53,000 students, but like many urban districts during COVID, our numbers have decreased and we're dipping closer to 50,000 by the time we officially report. We are a minority majority district, as you see from our data. Our families speak over 100 languages. We have a 21% special education rate, which is similar to other urban districts, but it also means there's a lot of students with need. And half of our students are second language learners. Our department is comprised of school psychologists, and we, back in 2010, adopted a comprehensive role. That means all school psychologists do tier 1 universal and prevention strategies, targeted tier 2 supports, and traditional intensive tier 3 mental health supports. And why that's pretty unique is in the field of school psychology, often school psychologists only work with students with special needs or students needing intensive support. But in our partnership with Children's, one of the major changes we made was ensuring that all school psychologists provided supports to all students. And that's really critical, and part of what Shella and I will talk about is changing people's roles to meet the needs of students. And that's one of the first things we did, is change the role of school psychologists and build up their skill set so that they could work with all students. So just a brief overview of our department. We'll give you a little more detail as we present our work, but this slide has some old data, but it's intended just to show the range of activities school psychologists do. So historically, school psychologists only did special education eligibility assessments. But when you look at this table, you'll see that the school psychologists in Boston do that range of tier 1 prevention work, such as facilitating teams, doing PD, doing consultation, doing tier 2 work, such as counseling and behavior management type of work, and then the traditional tier 3 work, crisis support, threat assessment, suicide assessment, psychological assessments, and working with students with IEPs. So it's a really busy group of school psychologists. And when we started this partnership with Children's, we had only 48 school psychologists to then meet the needs of almost 60,000 students at the time. So we were severely understaffed, and we knew that we needed partners such as Children's Hospital to really meet the behavioral health needs of students. Because with this range of work, you can see how busy the school psychologists are. So I'm going to pass it to Shella to tell a little bit about her programming.
So I'm employed by Boston Children's Hospital, and most people sometimes don't know that Children's has a school-based mental health program. So that's who we are. There is this important 4-part mission, but the bottom one about community is sort of my favorite. It makes the hospital a little bit unique and sort of in being a good neighbor. And I think it also helps us build bridges for access to care for youth and families outside of the walls of our hospital, and really meeting children and adolescents where they're at. And I think we all know that, Boston is a resource-rich city, and especially in regard to healthcare, but it's not true for all kids and all families. And so really coming into the schools and providing mental health care where they are is essential. So that's, you can change the slide. So we're in our 19th year. In partnership with Boston Public Schools, which is amazing. And I first started out as a school-based social worker. I worked in 5 different schools. And in terms of collaboration, Andrea and I have met and worked with each other for 20 years. We used to work in a similar building in Dorchester way back when we were young clinicians. So it's fun to think back about all of the years and sort of the different collaborations and the different ways that we've worked together. I've been the director of this program since 2008. And we have a team of 16 staff who are mostly social workers and psychologists, and we have a research and evaluation team as well. We have a lot of initiatives going on, but in the spirit of time, I'm only going to talk about a few of them today. But the number one question I get all the time is about our funding. And we have blended funding, and the hospital supports us, as well as we have funding from the Boston Public Schools. And we do a great deal of fundraising through philanthropy and foundations and grants. And I think the reason we do that is all about being able to collaborate effectively. So we're not bound by billing for our services, that we can actually meet the schools and the staff and the kids and their families sort of where they're at and do whatever it takes. And that has sort of always been our philosophy. And I think that has really put students and families at the heart of our model, but it's also allowed us to work closely with educators and school leaders. We see the school community and the community outside the walls of the school as sort of our partners. And so we've been really fortunate to be able to build bridges and do mental health work in schools as an outside partner a little bit differently. And so I think what's nice about our models, we really focus on all the different tiers in a public health model, from therapy to group work to classroom interventions, but also in providing training and consultation to school staff, which I'll talk about in a little bit as well. But I think the only other thing I'd add to who we are is we work really closely with the Children's Mental Health Campaign and really thinking about Massachusetts as a whole and different improvements and recommendations we can make, because some districts have figured this out and have really good staffing, while other districts are really struggling. And Andrea said, you know, she has something like 80 psychologists for 120 something buildings. We know that that's not enough. And so we're always thinking about, how do we work at the school level? How do we work at the district level? How do we work at the state level? Because there's a lot of schools and districts in Massachusetts that don't have enough, not even in terms of foundational staff, but then also in terms of partnerships. And so I think Andrea and I both would agree, like, this is our life's work. And I think we're really dedicated to sort of moving this advocacy piece forward as much as we can.
Did you want me to move on?
Oh, you can move on. Yeah, you can move
on. So you heard a little bit about just our day jobs, but we also want to talk to you about collaboration and why we chose to collaborate. And we each have a story to tell about that. So I'll tell my story and then share my story with share the mic with Shella. I began as the administrator of this department in 2007. And spend the first 2 years really just kind of improving the climate in our department and creating a better sense of team, which is really critical for successful implementation of anything. But then my team quickly realized that we could not meet the needs of students the way the field was historically set up. So again, school psychs historically just worked with students with special ed needs. They worked with students after a problem had already surfaced. And we only worked with about 20% of our students, and 80% of our students never had access to school psychologists. At the time, the National Association of School Psychologists changed the role of school psychologists to be that really kind of narrow role about special education eligibility to that comprehensive role that Shella and I have both mentioned. And when my team and I said, how are we going to adopt this role? We knew that it would be impossible to change how we operated unless we helped schools change how they operated. We knew we needed to bring in multi-tiered systems of support, or public health model for schools, into schools. And we also knew we couldn't do it alone. We needed partners. So I went into this partnership meeting that Shella and I will tell you about in a little bit. And I said to every partner at the table, we are going to change. And it's a big change. It's a long journey. Who wants to help? And the very first person that said yes was Shella. And that was the first day we started talking about, how do we make this change? And there were reasons, organizational reasons to partner together. There were people reasons, you know, us knowing we needed help, but keeping kids first, the kids really needed us to collaborate and create better systems. Do you want to add to that, Shella?
I have a little bit to add, but I do want to just sort of put this into perspective. Like, here we are being asked to talk about school collaborations. And I mean, I'm sure many of you know how quickly schools move and how difficult it is to actually have the time and the space. So we will talk about those things in a minute, but I think there are so many reasons to partner, not just between Children's Hospital and Boston Public Schools. I think we partner with many, many agencies, which you'll hear about, but none of us can do this. None of us can meet the needs of kids and families alone. And I think it really requires sort of that wraparound approach that we all know as best practices with sort of all hands on deck. Schools cannot do this alone, and schools actually were not designed to do this work. And so I think we also need to take a step back and be really humble about sort of what is the mission of schools and sort of how we are trying to teach the whole child, but we often don't have the capacity or the support to do that. So I think, you know, we came together and we've been able to be thought partners for each other. We've been able to be program developers. We support each other. We've looked for funding together. We've been colleagues. We also share a collective goal to support the youth and families of Boston, which is so essential now more than ever. And so I think not just us collaborating, but really bringing as many people as we can to the table. And we'll share some examples of that soon. So that's all.
And to Shella's point, we knew we needed to address a fundamental fact that our students in Boston did not have equitable access to behavioral health. It kind of depended on which school they went to, their parents' insurance, services in their neighborhood. And that's something we really are committed to, making sure that all BPS students have equitable access to high quality mental health. Because we know those inequities exist in urban districts, where students in urban districts are more likely to experience adverse childhood conditions. When they get health care, it's often delayed, so the intensity is often increased. There is such a delay for them accessing behavioral health that we knew that we had to develop a model, as Shella said, that wrapped around our students and families and kept them first at the center of what we're trying to do.
I would just add to that too, before you continue, about like, you know, there is, I always get a little bit nervous when people talk about urban districts and the rates of behavioral health concerns being higher. But we know that there's some truth to that. And I think we always want to put in that context about it isn't about biology, it's rather related to exposure and things that are happening in the community. So we're always thinking about poverty, we're thinking about food and housing insecurity, we're thinking about systemic racism, we're thinking about educational discrimination, we're thinking about lack of resources, community violence exposure. So we're always thinking about the needs may be higher, but we're putting it in a social determinants of health sort of framework, and also really paying attention to the numbers often are higher, the kids are often struggling more, and there are often less resources in certain communities as well. And so how do we change that balance? But how do we think about mental health differently? I mean, I think the current medical model feels very white and Western. And so we also need to bust that open and start to think about what do kids actually need, and how do we reduce stigma, and how do we make these kind of services or supports more accessible to families and something that they actually want to be a part of. And I think, you know, at the beginning of this presentation, I really appreciate sort of the frame about really asking students and families what they need and how services and support should be designed in that way. And I think that is the future of sort of how we think about school mental health.
Absolutely. I like that when I converted this from a Google slide to a PowerPoint, the sections of this moved, but it makes it look like it's in motion, and it is. It's partnership is very fluid and collaboration is very fluid. So I like that this graphic is moving, but these are really the keys to success. We've felt that we've been able to sustain this partnership for this long because we've looked at these essential elements of sustainability. Shella talked about program development. We do that in collaboration to ensure it meets all of the stakeholders' needs, including both of the agencies. We look at organizational readiness. In an urban school district that's constantly changing, I've had 27 bosses since Shella and I started to work together. So that's 27 people that we've had to convince this work mattered. And every time we have a new boss, that changes the organizational readiness. So we are constantly kind of continuing to build up the partnership to ensure the shared mission. And so it is a very fluid process. We spend a lot of time on implementation. We've done trainings for both of all of staff, any stakeholder we can get to on implementation fidelity and understanding how to do change and have that change stick. A lot of teachers have initiative fatigue. It's like, here's another new thing and that's gonna leave and that's gonna leave. And one of the things about the work that we've done is we've been here since 2010, and that's a long time in an urban district. And then evaluation. Shella's team and my team come together for a research team. It's pretty unique to have a research team within a district doing practitioner-led research, and part of the research is program evaluation to ensure we're actually meeting the goals that we collaboratively set out to do. What one of our guiding principles is bridging that research to practice gap. Shella's Hospital is a teaching university. Boston Public Schools is surrounded by universities. We have several university partners. One of our goals is to take the research about what helps kids and actually through implementation science, help our educators we work with implement that in schools. And that's been very part of the key to the positive outcomes we've seen for kids. So the first example of this collaboration between the hospital, we've also, the third essential partner in this has been UMass Boston. They're our local university that really has a community focus, much like Children's. And together, this partnership has created CBHM. I'm going to be very brief because we've got a lot of examples we want to show you. But in general, as I had mentioned, CBHM is a multi-tiered system of support. So kind of a public health model for schools, if you will, where we're really focused on behavioral health. Often schools are focused on academic wellness of kids. We have come in to really focus on the behavioral health of kids, ensuring they go to safe and supportive schools, that they're getting quality interventions. We do use a universal screener for behavioral health. That's pretty not very common. When we first started, only 3% of schools in the nation did that. Now it's up to about 10 to 12% of universal screening. However, a lot of the COVID re-entry plans are now calling for screening of kids. And we've been doing that for several years. We screen around 33,000 students a year to just get a check of their behavioral health. Collectively across this partnership, we've developed a logic model, and that's another thing that can help guide your collaboration, is having shared vision. And what we really hope to achieve long-term is increased academic, social and behavioral health wellness, the equitable services we've talked about, and safe learning environments. And what we have found in doing this in 78 schools for several years is really not shocking. But when you do behavioral health well, kids get better. Yay. But it's trying to do it well that's really the hardest part, trying to do it consistently and well and in culturally responsive ways. But we know that when we address the behavioral health needs of students, school discipline goes down, negative behaviors go down, more kids show improvements in their social emotional learning skills and their positive behavior. And we've really increased teacher knowledge about behavioral health. So the CBHM model, as you can see, has a variety of partnerships. As Shella mentioned, it's not just the three primary organizations, but from that, we've developed a whole host of local, state, and national partnerships. And I always joke that half of my job is really working with people outside the school district to bring in all these supports and services to schools. And sometimes I get pushback, but we've clearly found the more time that we spend building partnerships is the more resources we have for our kids. Oops, it looks like something happened here. So another example of collaboration is our school-based behavioral health collaborative. And I've been talking a lot, Shella, if you want to take this one.
I will sure take it. So I feel like it's so nice to have some institutional and like just historical knowledge of Boston public schools. But what we are really fortunate to have is 20 outside agencies coming in and partnering with the district to come and do services and supports. And there was a time early on where there was like really not coordination. And there were many of us who didn't, we were sort of, it was kind of the wild, wild west. Like as directors, we were partnering with schools. And some schools there was one point where a school had 7 mental health partners. And so, you know, I feel like with Andrea's leadership, I mean, this is sort of a longstanding collaborative. But now I think we're having a month, you know, we've done so much, and we wanted to share this with you as like one of the best examples for collaboration. And you don't have to have 20 agencies. You could even have 2 or 3. And I think we're going to share just some of the things that we have worked with with each other over the last decade. So Andrea, you can share the next slide. But I think the most important thing is there are standards of practice for partners. And, you know, although many of us in social work and psychology are really well trained, some of us aren't trained in school mental health. And so what has been really nice is just to have standards of practice that do eliminate, really share, you know, even around interns and what are some of the practices and who are your go-to people. It's been really essential for Boston to have this sort of manual and approach. And then that leads into having agreements at every single school level with the district as well. And so that this isn't something that is being negotiated school by school, and really having Andrea's leadership to really sort of assess and make sure that there are equal partners throughout the district as well. But I think one of the most important things that has happened in this group is that there is an annual conference, and there's not just one conference. I feel like there's training opportunities all the time. And Andrea, you are amazing at sort of opening up training opportunities for people. But this past Monday was a great example. And so maybe, do you want to talk about that, Andrea? Because you just led up one of these amazing events.
Yeah, one of the things this collective group has done now for, I think, 9 years is hold an annual conference that brings together the community mental health partners and the school-based mental health clinicians. So Shella's team and all of the mental health partners, their clinicians, as well as the BPS school psychologists and social workers. And this year we actually added the nurses as well. And the focus of the conference this year was supporting students through trauma, given the trauma so many kids and families have faced during this COVID closure. And we come together for a day-long conference. It's usually free or very low cost, like $20, and you get breakfast and lunch low cost. And part of it is to ensure that all kids have, if we really want to focus on all students having equitable access to quality mental health, we know that we need to do training for our mental health staff. So even though they're not my employees or all of Shella's employees, we want to ensure that they all get training on evidence-based practices. So that's what this conference does. Each year we pick an evidence-based practice that we want all of the staff to get, and we find a way by borrowing and partnering and begging to have this low cost conference. This year we did psychological first aid. In the past, we've done CBTH, which is a training for students with trauma. We've done coping cats, which is a CBT training for students with anxiety. We would love to do some of the more intensive long-term trainings, like some people like ARC, for example. But each year we pick an evidence-based practice we want everyone to get. And then last year and this year, given the intense needs our students have been seeing with behavioral health, we did a monthly training event as well as this one-day conference.
And I think what is most important about this, just from where I sit as a program director in the city, is I know all the other school-based mental health providers and directors now. And I think without having this, we are often working in silos. And so for those of us who have been doing this a long time, it is incredibly powerful to be able to pick up the phone when there is need for thought partnership or consultation. But I think the elephant in the room is there is always a crisis as well. And I think when we can team up and work together, some of our crises are more individual, but we do have community events as well. And knowing that we are there to support each other, that we can support the schools and Andrea's team, and as well as the district, is it's been something that has been sort of life-giving, I think, for many of us. I mean, I think a lot of our providers, you know, we do know there's a great deal of emotional exhaustion. These jobs are hard, but also knowing that there's some coordinated efforts and that we can actually talk about not just our individual cases, but also our models and our approach. And I think this training on Monday, like I was so fortunate to go, there was a 2-hour session really on racism as well, and really thinking about really, you know, the populations, the districts that we work in, and having conversations across programs and is really, it's just been, it's probably just my favorite example of, you know, you put some structures in place, and I think it really allows people to collaborate, build relationships, and realize that, you know, we don't have enough. We don't, even in Boston with these positions and these partners, there's still greater need. And so what can we do to really think about not just, you know, collaborating now, but thinking about the advocacy piece and also fundraising for the future and doing things differently. And I think thinking outside of the box. And so I'm just really grateful that we have sort of structures like this that allow these conversations and collaborations. It's amazing.
And I'll just add, Shella, one of the biggest accomplishments is when we set out to do this, we joked that Shella and I could retire when there was a full-time school psych, a full-time social worker, and a full-time mental health partner in every building in BPS. And when we started, we had 6 social workers. Last year, the superintendent and the year before, the mayor made a commitment to increasing social workers. We now have 157 social workers. So we went from 6 to 157. Every school in BPS has a social worker. We're so happy about that. When Shella and I started, only about half of our schools had a mental health partner. Now 100 out of 124 have a mental health partner. So we're almost there. When we started this, we had 48 school psychologists. We now have 83. So we've almost doubled the number of school psychs. We're still not quite there with school psychs. We need more, and we need more mental health partners, but look at that incredible growth that's happened through this collaboration. And then the last example of collaboration we want to share is TAPT, Shella.
But we are out of time too, and we want to open this up for questions. So I'm just going to share really briefly that, I think one of the things that we're most proud of is, I shared our funding for a reason, because it allowed us to be innovative. And we kept hearing from teachers that they didn't have enough training. We kept hearing from mental health staff that they didn't have enough training. And so we were able to sort of over 6 years work with 25 different schools and a learning collaborative in Boston. We developed 11 workshops. They were 4 hours each. We were sort of teaching teams and then having teachers go back and share it with their schools. And we kept getting asked, I want to be a part of that learning collaborative. I want these trainings. Can you put them on the web? And so we started doing some really high quality videos, and we now have put a series of trainings on the web. It is called Tap Online. We have shared it broadly. You can go to the next slide, actually, in the spirit of time. One of the things we're most proud of is we always feature Educator Voice. We're always sort of looking at best practices and evidence-based strategies. And we do want to really sort of make sure we're talking about self-reflection as well. And so this is something we've been working on for, I think this is our 7th year. Molly Jordan leads us up on our team. We have a great team of social workers and psychologists working on this. The next slide, Andrea, is the topics that we have up. And they're free, they're open source. And we, just to be really transparent, we developed this with educators in mind, and we developed it with school leaders in mind and school staff, anyone who works in a school. This was for them. We have gotten a lot of mental health clinicians signing up for this, and they're saying, I've gone to tons of training. I have a ton of training, but I don't have training that's related to schools. And so we have been incredibly flattered that we have this audience also of providers and clinicians who have taken this course as well. So we welcome you to join, and we would love you to share this with others. We have 5,000 people around the nation we haven't been marketing it much, but we're trying to sort of share it. We also have an anxiety documentary for parents on our website as well. So we would love you to share that with families and caregivers that you're working with, because especially right now, we know anxiety is quite a popular topic. But this also is just a collaboration where we can work with the district. We can sort of fill a need. And Andrea, your team does a ton of training. So I don't want to say that this is something that we did that was special. But I feel like what we did do that was special is we had the time and the resources. And often we heard from psychologists and social workers that they were asked to do a training and then they had to deliver it 2 days later. And we were like, oh, let us do some of this legwork. Let us put some of this stuff together. And we just hand our PowerPoints over. We have talking points. We also just wanted to be able to say, if there's things and ways that we could, just do some of the lit review and some of this other stuff that I think often gets lost in the day-to-days of schools. And, we joke all the time, there's always a cod of the week or a cow, the crisis of the week, the crisis of the day. And we were really, with flexible funding, able to step back and start to develop trainings that were really designed for school staff. And so we're happy to be a partner and a collaborator. And we wouldn't be able to do this work without Andrea's team. And we always are doing needs assessments and what topics should we do. And so it's been a really nice partnership in that regard, and that we're doing something that has always got schools at the heart, and that we always have school input, school staff input as well. So happy to share that as well too.
And so just in summary, these are some of the things that we have found to be successful. We have found that in these efforts that Shella talked about, we can coordinate our responses. So I'm not wasting my time building a PowerPoint if Shella's team is doing it, right? We've found that we can coordinate our staff PD. We can respond to teachers' needs collectively. We've found success in spreading our partnerships outside of these organizations to city and statewide organizations. We've done a lot of advocacy for children's mental health at the local, state, and national level. As Shella mentioned, we've done joint fundraising. And I think because Shella and I have remained in our positions, as well as Dr. Melissa Perot from UMass, then we've been here long enough now that people start to kind of coalesce around some of this work, you know, instead of like when Shella said, when we first started, it felt like nobody was working together. And now there's definitely some working together happening. We've been able to produce many peer reviewed publications about our work with our outcomes, and they're on our website and Shella's website if you'd like to see them. And some things we've learned, we've spoken about, but I think there's really important that it takes a deep commitment across the organizations. The 6 individuals that started this in 2010 are all still employed and part of what we call an executive work group. When we first started this collaboration, we met every single week for like 3 years. And now 11 years later, we're still meeting every single month with those same core people. We've added people, but that time commitment together has been really important. We also, as we shared with you, our goals and objectives, we came together on a common goal. It wasn't, what do I want? What does Shella want? It's together, what do we both want to help kids? And it takes time. We have to give that time to come together, to collaborate, to share resources, to be thought partners, and build that trusting relationship. One of the things that's helped us grow is OUCH. It's being able to, we did bring in an external facilitator. I think that was a smart thing that actually Shella recommended at the beginning. And that external facilitator who doesn't belong to any of the organizations, one of the things he's helped us do is establish protocols to push each other and to give feedback. Because it's not just like, oh, we're all besties and let's just be quiet so everyone is happy. It's like, no, let's push each other to grow and be the best we can be for our kids. Shella, did you want to add anything?
I mean, I would just say, I think it's so fun to talk about this stuff, but the reality is, you know, this takes so much time and effort, and I think, but it's worth it. I was just reflecting as you were talking, Andrea, about like, we've had some of the most challenging conversations as professionals, and I think it's made all of us grow. I mean, we're working in a district where many kids are facing racism and discrimination, and really sort of like we have to put the kids and their needs at the heart, and thinking about, you know, how are we really helping, how, you know, what systems and structures are actually limiting, and what is really perpetuating racism in our district, and especially like the terminology around behavioral health and mental health. It's really challenging. And so I just sort of am really grateful that we do have this core group, but we're also thinking about who is at the table, who isn't at the table, whose voices do we need to be heard from. It's just been really powerful. But I just want to say it's humbling and it takes work, but it's possible. And I think, you know, just Andrea and I have spent our lives in schools. I think we're probably going to spend many, many more years to come doing this same work. But knowing that it changes a ton, and that, you know, I think the cycles and changes are to be expected, but that, you know, truly leadership matters. And it's been just an honor to partner with Boston Public Schools in this way from a hospital perspective as well.
So we are out of time. Sorry we had to go so fast, but we thank you for hearing about the great work. This is some pictures of my team, and Shella has an equally incredible team. And both of our websites have information, additional information that you can find. Thank you.